Hello, I'm Henry Acosta, and you're listening to Health Professional Radio. Our guest today is the CEO of the Australian College of Nursing, or better known as the ACN. She's been very successful with her nursing career, as she has held top positions at 3 major health services in New South Wales and Victoria. She is Kylie Ward, and she is with us today to talk about the ACN, National Diabetes Week, and the Choose Wisely Australia campaign that is pushing for diabetics to do self-management with their glucose levels. With all that said, welcome to Health Professional Radio, Kylie. It's great having you here.
Thank you.
Can you give us more story about yourself, and how did you get started with getting with ACN?
I have been a member of the predecessor organisations, the professional colleges, for 20 years. I have always been a believer as a nurse that it is very important to be involved in our professional college. And so the Royal College of Nursing Australia and the College of Nursing, I was honoured to be a member of both, and then was granted fellowship status. And so there was an easy transition as those two organisations unified to stay committed to the Australian College of Nursing.
How did you get started with the Choose Wisely Australia campaign, and why is it so important?
We felt at the Australian College of Nursing very honoured to be the first and the only nursing organisation invited to participate in the Choosing Wisely initiative. And we went to our members and fellows and out to nurses from all around the country and from varying specialties and areas of expertise to determine what were the priorities for nurses to look at driving improvements in less interventions and less procedures for patients. And one of those, as you have alluded to, that we determined was that there was no indication for any changes to a patient's BGL monitoring unless there was any clinical indication. So to honour the patient knowing what was best for them.
With regards to that, what do we have to know about it to people who are diabetic?
People living with diabetes know their condition. It's a chronic disease. What is really important to the nursing profession and for all nurses is that we work with patients, we advocate for patients, but only and for consumers, but only when they cannot speak for themselves. So if somebody was to come into hospital and or a health setting and there's no clinical indication to change their BGL monitoring, then we would suggest not to interfere with that. Don't put them on TPS. Don't prick somebody's fingers that are already quite tender, and leave them to monitor their own and to maintain stability with their own diabetes management.
Yeah, you think it's going to be easy to teach people or teach diabetics on how to monitor their own levels?
Those living with diabetes will already have education from nurses, health professionals, diabetes educators do a brilliant job in working with people living with diabetes to understand the disease and how to manage it and how to monitor it. So I feel very confident that those who have been living with diabetes for some time really understand the monitoring and management. It is really for health professionals and for nurses when people present to a hospital or health setting where there's no clinical indication that we don't interfere with that.
And what do we have to know about the National Diabetes Week?
For all health professionals, and certainly on behalf of nurses are very well connected and at the forefront of healthcare delivery all across the country. As you know, we're the backbone of the health industry. So nurses are really well placed with people living with diabetes as well as all chronic disease to promote people managing their illness, to promote health promotion wherever we can, and for people to feel empowered in the decisions that they make for those living with chronic disease.
Mm-hmm. And are there any misconceptions that keep you up at night with regards to the current campaign that you guys are doing?
The one area that I feel is something that is a focus now for the nursing profession and for nursing leaders is that nurses are pivotal to healthcare delivery and to the patient experience and to patient outcomes. And so from my perspective, it's very important that we shift the change. Nurses are underrepresented, not represented, and disproportionately represented at the highest levels of decision making in this country. And in my mind, that is unacceptable as we move forward to the health reform that is required for aged care and healthcare for the future. So if anything was to keep me up at night, it is definitely, I am passionate in pursuing that nursing has a voice at the table, is heard, is invited, and that it is recognised widely that it is important for the profession to be there.
Yeah, and for our listeners right now who are maybe nurses, what is it that you want them to take away from this interview?
We are privileged to work in an incredible profession. We have a very well-connected, the Australian College of Nursing is a very well-connected and national body. We seek to enhance the delivery of health services to the Australian community. To be a nurse is to be a leader, and that's where we put our focus, is in advocating in the areas of policy, education, membership and leadership. And so I would say to every nurse out there all around the country, know who we are, know our worth, be proud of what we do. That's not just to be celebrated on an International Nurses Day, that's to be celebrated every day. We are, for the 23rd year in a row, the most trusted and ethical profession. And it's an absolute honour and a privilege to be part of this wonderful profession.
Yeah, and with the ACN, are there any campaigns or any certain events that we should be watching out for?
Yeah, definitely. There's a couple of things that we have. We have coming up in August, on the 21st to the 23rd of August, is our National Nursing Forum. This is the signature event of the year. We will have hundreds of delegates from all around the country and from all areas, representing all areas of the profession and the health and aged care settings. We will have undergraduates through to retirees, and it will be a discussion about the nursing profession, the issues that are topical right now. We've got an exceptional lineup of speakers, and to complement that, we have nurses from all areas presenting abstracts for the work that is contemporary and worthy of being shared on the national platform. The other area that I would just like to highlight in our commitment to pursuing leadership and developing leaders is our Emerging Nurse Leader program. The Emerging Nurse Leader program has been in place since 2012, but last year we remodelled the program and we extended it. Initially it supported emerging nurse leaders who are undergraduates, and this year we have extended the program to promote nurses in the early stages of their career as well as third-year undergraduates. And this year we have 36 emerging nurse leaders. There is an expression of interest out right now, which closes on the 31st of August for our 2018 intake. And we are able to welcome up to 50 emerging nurse leaders from around the country to this program. They get mentoring, that it's an exceptional program of empowerment and understanding the leadership qualities required for the future. They're connected to experts in the field and also gain a very strong network within the group. So that's very exciting. We're very proud of that.
And can nurses from all around Australia join that? And what's the best way to get involved with your campaigns?
Through membership. We love our members. We are passionate, and I really look for members who want to be the best they can doing what they're doing right now as a nurse. They're the type of members that we have, people who are proud of the profession and want to advance the profession. And so my suggestion would be if you're not a member, join as a member, aspire to fellowship. And if you're a leader or a manager or a clinical nurse consultant or a specialist in an area and you can see either an undergraduate or an early career nurse up to 6th year, then certainly advise them to get on our website and apply for the Emerging Nurse Leader program. And for those nurses to invest in their own clinical professional development, absolutely come along to our National Nursing Forum and connect with like-minded people and have a fabulous 3 days.
Yeah, and when is the Nurses Forum going to happen?
It's in Sydney at the Star, and it's on the 21st to the 23rd of August this year.
For our last question, for those people interested in maybe talking to you and getting in touch with the ACN, how can they get in touch with you guys?
I would get to the website, www.acn.edu.au, and connect with us. Send us a message. Let us know. You will find phone numbers on there and emails and ways to access us. But just type in Australian College of Nursing and you'll find us.
Awesome. Well, that's all our questions for today, and thank you so much for getting on the show, Kylie.
My pleasure. Thank you.
And that was Kylie Ward, the current CEO of the Australian College of Nursing, or ACN. We just finished talking about the current news and what we should know about the ACN and their new campaigns. If you like this interview and you're interested in learning more about health-related news, medical research, and fitness, you can go on www.hpr.fm to keep up with our news and updates. You can like us on all major social media platforms. Audio is also available with SoundCloud and iTunes. Once again, I'm Henry Acosta, and you're currently tuned into Health Professional Radio.